So all those decisions coming from mathematical models and projections of how the virus will spread. Faye Fredericks explains how Arizona is drawing the curve.
State authorities say they project peak infection rates will hit in mid-April, peak hospitalization early May.
When we look at the modeling based on the number of cases and the trajectory, we anticipate that we could need an additional 13,000 hospital beds and an additional 1,500 ICU beds.
So how are they coming up with that? By using computer modeling, entering data, using that to mathematically illustrate what could happen. You probably see versions of this every day in things like weather forecasting. Al Katawazi, a data scientist and developer, is an expert in the field, working on projects for state government and huge tech firms like Amazon. When it comes to modeling COVID-19, he says it's all about the beds.
Even if you run a basic model, you can start to see that the number of hospital beds, specifically ICU beds, is pretty limited in the state.
One of the most important variables in the COVID-19 model is the R0. It's the average number of people who will catch COVID-19 from an infected person, 2.3. The flu's number, only 1.3. While it may not look like a huge difference, over time, the curve that the models are showing is dramatic.
Once you start looking at those big numbers, even if a very small percentage, let's say under 1%, require ICU beds, it's going to mean that we are going to be saturated.